What do you do if you don't have a doctor? Perhaps you're not sure you can afford it, or perhaps you're new to the United States. Maybe you're already not feeling well. The healthcare system is complicated, and where do you start? At Birch, Bates, and Blake Streets in Lewiston, Maine, you'll find the B Street Health Center. Our mission is to make staying healthy easy. It begins with a phone call.
Hi, I'd like to set up an appointment.
Yes, I'd be happy to do that. Are you an established patient?
We'll make an appointment to see you as soon as possible. If you're sick, we'll see you the same day or the next. That's right. We want to make it easy.
9 o'clock, March 3rd. I'll see you then.
I've been sick for quite a while. I've been putting off going to see a doctor because nobody wants the extra bills or hear any bad news. And one day at work, I was so bad that I had to leave. A friend of mine told me about B Street Clinic. So I called them up, was able to get in the same day, and very happy. Nice doctors, good staff.
We'll make it easy. All we ask is, if you can't come into your appointment, please call us or ask your interpreter to call so we can give your spot to someone else. And please remember that if you're late, you can lose your appointment. When you arrive at your appointed time, our receptionist will help you get started.
Good morning. Do you have an appointment? Okay. What's the name?
Zara Osman, Somali
Our cultural broker can help our Somali and Ethiopian clients fill out paperwork, and then an interpreter can be on hand or on the phone to see you through your visit. At the first visit, you'll want to bring all your medical records. Patients new to Maine should bring their IOM bag or packet of paper information from back home. Bring any immunization records or at least the name and location of your previous doctors. You'll also need your health insurance card, whether it's Maine Care or from a private company. We need to see the card at every visit. If you can't afford to pay for your visit, please tell the receptionist right away so you can fill out the paperwork that can help you pay for your visit or lab tests. Every time you come in, you'll want to bring your current medications, even vitamins, so we can be sure what we prescribe works with what you're already taking.
Kristen? Hi, how are you?
Good, thank you.
Good. My name's Samantha and I will be taking care of you today.
Okay.
The nurse will get your height and weight and show you into an exam room. It's okay to have someone go with you into the exam room, including an interpreter. We try to match the gender of interpreters and nurses to our patients so everyone feels comfortable. This is where the nurse checks your vital signs and goes over the reason for your visit.
His blood pressure was 122/80.
La presión era 122 encima de 80.
Bueno, sigo tomando las pastillas de presión entonces.
So I should keep taking my blood pressure pills?
I would advise you to continue taking your medicine until you at least talk to the doctor, but right now it looks like your medication's doing exactly what it should be.
Mi consejo, señor, es que usted siga tomando su medicina hasta que hable con su médico. Ahora se parece que la medicina está bien y está haciendo todo lo que debe hacer para usted.
Muy bien, gracias.
The nurse will be the one to review your medications. For a physical exam, she'll ask you to change into a gown. You'll need to take off shoes and socks because the doctor will want to be able to check for diabetes and other illnesses that can be seen in the feet.
So what brings you here today?
I'm happy to see today that both my doctor and my interpreters are women. In addition, the type of help and assistance that I received is indeed much appreciated.
maanta waxaa leedahay caloosha ay xanuunayso dhabarka kulli waa xanuunaa habeenku waa hurdi waay.
She has a problem with her stomach and also lower back pain.
When did it start?
Goormuu bilaabay? Goormay kuu bilowday markii horeysa?
Sabtigi ilaa axadda ilaa ay xanuunaysaa.
If the doctor decides you need any lab work, including blood tests, we make it easy. We have a lab right here, so there's no delay or need to go to another location. Sometimes we can even give you the results the same day. It's also easy to follow up with getting your medications. For many prescriptions, we can call them into a pharmacy that's convenient for you. Please be sure to ask your provider if you'll need to refill the prescription again in the future. Some medicines are prescribed for lifelong conditions, and you'll need to know how to keep a supply of the medicine at home so you don't run out.
We came in, they prescribed us the antibiotics. We took them for a couple of days and he started to feel better, so we stopped. We learned pretty quickly though that was kind of a big mistake. It's a hassle giving a 2-year-old medicine, so it's easy to stop, but it's more of a hassle when he starts getting sick again, dealing with a 2-year-old with an ear infection.
Please be sure to follow the directions for taking any medicine. If something seems to be not working, or if you have any questions, it's easy to call the office and get advice. After your exam, the doctor may refer you to another doctor or specialist who can help you with a specific problem. You may be referred to St. Mary's Auburn campus located near the mall for physical therapy or help managing diabetes. Many other specialists, from cardiologists to surgeons, are located at St. Mary's Regional Medical Center. Clients aren't necessarily staying overnight in the hospital. This is just where many doctors have their offices. We know it can look complicated, so we'll give you directions on where to park and what entrance to go in to find the doctor you need. Interpreters and plenty of friendly staff are on hand to help you find your way around. Our Women's Health Associates are located in the Women's Health Pavilion on the hospital campus.
I have an appointment here with Dr. Tardif today.
Here we offer health services to women of all ages and in all stages of life.
I had both my children at Women's Health Associates, and I had wonderful experience with both the physicians and the midwives that both helped me through my birthing. And the staffing is so wonderful, and atmosphere is welcoming and homey. It was a wonderful experience.
You may find that in addition to the treatment for physical symptoms, you may want help with mental or emotional concerns. Many of our patients aren't familiar with the mental health services, but we treat mental and emotional problems as often as physical conditions.
I am here today at B Street Health Center to get assistance for my sleep problem or lack of sleep, insomnia. The staff welcomed me nicely and assisted me with my health problem. Thanks to God, now I can sleep well.
Counselors work right here on site in a comfortable setting. In addition to counseling, you may receive help with medications to manage stress or depression, and our care manager's job is to connect patients with community resources like Main Care or housing assistance.
What we're going to do today is we're going to do a dental cleaning. We're going to look at your teeth, maybe take some x-rays, and see how you're doing overall.
For our patients 15 and younger, we're also able to schedule dental appointments right here with our B Street dentist. We make it easy for children to keep their teeth healthy. After your physical exam, you'll receive a card with information about your next step.
And I have an opening on Tuesday at 8:30.
It will tell you when to call to make your next appointment. Instead of making appointments far ahead of time, you just need to call on the date you're given, and once again, we'll make it easy and get you in as soon as possible. Of course, if you have any urgent needs or questions, please call anytime, or in a real emergency, call 911. An ambulance will bring you in, or if you're able, you can also go directly to the hospital. St. Mary has an easy-to-use emergency department with a welcoming atmosphere. Our goal is to see you in 30 minutes or less. We have separate emergency areas for either physical trauma or emotional crisis. In behavioral emergency department, there are even separate areas for children and adults, so everyone is as comfortable as possible. We consider our patients to be partners in healthcare. You and your provider will work together to maintain your health. Your part in the partnership is to keep us informed of changes in your health, keep your appointments, and complete any follow-up care that is prescribed. It's important to follow doctor's orders to stay healthy. Take medications as directed, and please bring your medications when you come in. If a medication doesn't seem to be working, or if you need help getting refills, please don't hesitate to call. Our part in the partnership is to be a responsible provider and make accessing healthcare as easy as possible. We will share information with you, work together, and be respectful. When I lived in my homeland, my children never had adequate health care services. Since I moved to this country, my children have received complete health care. As a result, the quality of my children's living standard has improved dramatically, and I am very happy with these health care services. Doctors prefer to help you stay healthy instead of waiting until there's a problem. Whether you or your loved ones are sick now, the best move you can make is to call up B Street and find your healthcare partners today. We make it easy to stay healthy.